Our special guest today requires no introduction. However, I wasn't going to miss this opportunity to say how delighted we are to have you with us today at our final Fellows event. For many years, you were the Chief Medical Officer for England. You contributed with Keith Widge to the delivery of the critically important UK AMR National Action Plan published last year alongside the UK 20-year vision. You're now in a new job, Master of Trinity College, Cambridge. You've also been appointed to the UK Special Envoy on AMR, representing the UK government on that subject internationally and with a special focus on the UK's globally facing activities. You've used your influence not only to improve health at home, but also overseas, promoting resilience in health systems in low and middle income countries. You've been an amazing advocate for the CPhO programme, and we were thrilled when CPhO featured in your final annual report, Partnering for Progress, which has been well received and widely quoted across the world. So, Dame Sally Davies, what do you miss most about being the Chief Medical Officer? And how's the new job going?
Well, I do miss it. And people ask me, do I wish I was there? And actually, no. I think I'd done my time, and my successor is an infectious disease doctor and is a really great guy, so I trust him. I miss most having that platform to influence for the things I care about. I mean, I still have the UK Envoy role for AMR, which is a platform, but those annual reports that I did year after year allowed me to focus on things that I saw as Cinderella areas, whether it was women's health, global health, public mental health, that others were not taking notice of, and bringing them to people's attention and making them think about them. And actually, the penultimate one, the one before the global health one, was about health in 2040. And along the lines of whichever management guru it is who says what gets measured gets done, I recommended that the nation needs, next to the GDP, a composite health index. And do you know what? The Office for National Statistics, ONS, has been commissioned by government to produce it. We're going to have one. So all of that was such fun. And of course you miss it. I'd probably miss the travel, except that's not changing jobs, that's COVID. And I really miss my private office because, you know, if I had a thought aloud, they made it happen. They were all so wonderful. The civil servants, I can't speak highly enough of. So I miss the people and the way we could make it click like a great machine. That said, what a wonderful place to pitch up. Trinity College, to be their first outsider as a master, the first woman, and here at a time when my public health background is pretty useful to them. And I meet such extraordinary people, and I love working with the young. So the idea that I'm here for a few years working with students and trying to help them, you know, really learn and blossom appeals to me immensely, and I'm enjoying it. I don't believe anyone has had such a beautiful gilded cage to be locked down in as I have. Here you see my study, the master study of the lodge. I live in this beautiful medieval house with perfect gardens that run down to the river. And in those glorious sunny times, we were having breakfast, lunch, and dinner outside. It's so lovely. But the UK Envoy bit is on AMR is more difficult because everyone's focused on COVID. And I'm sad about that. We're doing our best to kind of pop it up everywhere. And I'm sure we're going to talk a bit more about it. But I had expected and wanted to do more on AMR than I'm managing. But we'll get there. I haven't given up. I care passionately about this.
Thanks, Dame Sally. I've got a question for you now about our current fellows and the experiences that you might have had in your travels. So all of our fellows have travelled to one of the 4 African countries that have been part of our CwPAMS programme. Dame Sally, when have you previously travelled with work to sub-Saharan Africa. And could you just tell us a bit about where you went maybe and how it has impacted on you both personally and professionally?
I'm particularly keen on this programme, and I congratulate all of you and of course Keith Rich for making it happen, because what I found when I went abroad was I always learned a lot. I bet I learned more than I was able to help others with. Seeing how people find, I gather the term is frugal, but ways of handling problems without spending money with limited resources makes you think about your own service and what you do and learn how lucky we are, but see different ways of doing things. So I was lucky. I went in the early 90s and then again in the early 2000s to Nigeria, not just to Lagos, but I went over to Enugu in the east and then up to Ile-Ife, and both were wonderful experiences, seeing how people lived, how they coped, and hearing their thoughts about it, and seeing patients. My subject is sickle cell disease, patients with textbook illnesses that I, in Britain, had not really seen because we, with our wonderful NHS, had got in early. So I learnt a terrific amount, and the warmth of the people and the friendships you can make. I think the friendships would have lasted till now if we'd had all this wonderful Zoom technology and everything, but writing letters and eventually emails is not the quickest way. But I think everyone benefits. I know I did, and I enjoyed those trips immensely. I also went to South Africa, though that's a bit different, but it was very interesting because as a student, I was always demonstrating against apartheid. So to go and see South Africa as it is now and to learn the differences and what more needs doing. Like here, how do we widen participation? How do we get people who had not thought of going to university, they thought either because they weren't interested, yet it is fun and fascinating, or because they thought they couldn't do it. How do we excite them and help them so they can come? That widening participation and increasing opportunity matters so much.
Thank you so much, Dame Sally. That is just so inspiring to hear your experience, particularly going to Nigeria, not just visiting the capital, but going into other cities as well. And just going back to antimicrobial resistance, as Sarah said earlier, you know, I always go out and say that if there's one person we can say that's changed the trajectory of tackling AMR across the world, it is you. Just wanted to ask, you know, with the current pandemic that we have at the moment with the COVID-19 pandemic, how do you think it has helped or hindered tackling antimicrobial resistance? And what do you think we need to be doing now?
I think it has hindered. A lot of people are ending up on ventilators, fewer as time goes on. And I think that's two reasons. One, we're seeing more young people who don't need the ventilators. The other is that hospitals are learning how to use CPAP, BiPAP, pronation, and therefore not using ventilators as much. But most who end up on ventilators end up on antibiotics, whether it's a viral pneumonia or problem or bacterial. So antibiotics are being used in what I would call a profligate manner, and yet I don't blame the clinicians. How can they tell if they don't have the sensitive tests? So we've got the overuse across the world. It's happening in the very rich countries and the poorest countries. And then the whole of global health is focused on the pandemic. So it's very difficult to get airtime to think about AMR. I know it'll come back. And what we're trying to do is reboot the AMR campaign, saying, well, if you're worried about a pandemic, how do you notice there's a slow pandemic creeping up on us and you're not doing something? In fact, I often talk about the lobster metaphor. So if you drop a lobster into hot water, it makes a lot of noise as it dies. So the RSPCA recommend that you put it in cold water and heat it up gently, and apparently they don't notice it and they don't make the same noise. And I think that the pandemic is a lobster dropped in the boiling water, and AMR is this slow heating up to boiling point. And I, and all of us, want to change things so we never get to simmering and boiling.
Thank you so much. It's been an interesting year for all of us, the last 3 years since this programme started, but your support all the way through it on every level has meant an enormous amount to me personally, and I know it has for the programme. I don't think it would have got where it was without your support and that from Keithridge as well. Thank you so much. I'm eternally grateful. Well
done, all of you. Come on. You made it happen. It wasn't me. I found some money. I'm quite good at that. 3 are central to it.
Oh, thanks, Dame Sally. I just want to reiterate what Diane and Sarah have said, really, and just thank you for your support. And I think the fellows are probably, you know, aware of the programme, but I don't know if they're aware of some of the things that go on behind the scenes. And your support at the Commonwealth Heads of Government meeting, particularly last year, getting this on the agenda so that we could actually present to the health ministers this work was really, really important. In terms of raising the profile of AMR amongst the Commonwealth, and also the role of pharmacists. So just a huge thank you to us in every respect, and I hope that you'll continue to be part of this, and we'll see more of you in the future.
I hope so. Now I'm here in Cambridge with all of you.